CanCOVID is an open science collective dedicated to rapidly mobilizing and sharing knowledge to help inform Canada's COVID-19 response. To learn more about us or how to join our community, you can visit our website at cancovid.ca.
Great. Welcome, everyone. My name is Carrie Bourassa. I'm the Scientific Director of the Institute of Indigenous Peoples Health at CIHR. I'm also the research lead at Morningstar Lodge, and I'm honored to be the moderator for this important workshop today. So I want to thank everyone. I want to thank Susan for having us present today, and very honored to be able to moderate the amazing staff from Morningstar Lodge. So we're going to ask each of the presenters to share their own introductions, if that's okay. So I think what we'll do is ask each of you to do that, but I want to do the land acknowledgement first, if that's okay with everybody. So I wanted just to take the opportunity to acknowledge the land which we're presenting from, which is Treaty 6 territory. That's the traditional territory of the Cree, Dene, Nakota, Lakota, Dakota, Saulteaux, and homeland of the Métis Nation. And so I also just want to draw your attention briefly to the basket of tobacco ties. And tobacco is one of the 4 medicines. And we use tobacco ties, or bundles, as I often call them, in ceremony. And we give tobacco ties to elders, and we ask elders to support us in ceremony and in prayer. And I also, of course, want to honor the 751 children who were found in a mass grave at Cowessess First Nation, and we send our prayers and love to the family and the communities. To our kin and our families and the communities. Miigwech. If you want to, yeah, you can flip the slide. This is not important. So if we can just start to please share, those of you who are here today, and then we can share the rest of the team who aren't able to be here today. So who wants to start? I see Danette, I see Carrie.
I think we'll introduce ourselves when we do our few slides, Carrie. So do you want to?
Oh, okay. I didn't.
Yeah. So I
didn't know we were doing it that way.
Yeah, and we do start with Patrick. Okay. So he's first.
Okay. All right. So Patrick, I probably want to flip the slide then, I guess.
Thank you, Dr. Carrie. So I'm Patrick. I'm one of the newer members of Morningstar Lodge. I'm not Indigenous. My background's more in public health. And I often feel pretty fortunate to be a part of this team. Before starting here, I had mostly just read about Indigenous research methodologies. And I saw a lot of promise and was excited about what I was reading. I really only had one really good opportunity to try to put all of this into practice during a practicum. And everything turned out to be a lot more complicated than I had expected. The experience was certainly informative, definitely humbling, and a near complete failure, if I'm being honest. And some of the reasons for this lack of success ended up being pretty difficult for us to work through or work around. Like, cultural safety is needed for harm-free engagement, but engagement is needed to define cultural safety. Or Indigenous people are so diverse that there's a lot of different versions of cultural safety out there. And while the differences may be subtle, you still at some point may need to kind of make a choice on which direction you're going to follow. And the point I'm making here is really just that there are a lot of ways to go wrong when working with Indigenous communities, even for eager, well-read, well-intentioned researchers. And the exact ways we worked through those issues during my practicum, they're not really important here. They worked for us, but there may never be a consistent set of methods or a checklist to follow when working with Indigenous communities. They're all different, and our approaches really need to reflect that. That being said, Morningstar Lodge does show that there is some consistency to be found. The lab, it provides an exemplar of following community lead and listening to their solutions in order for research to be done in a good way. And when it is done in a good way, the outcomes are actually relevant and truly contribute to the changes that communities are looking for. So in this presentation, you'll learn about how Morningstar Lodge continues to do research in a good way during and in response to COVID-19. We'll talk about our partnerships and community engagement and how this drives our research. We'll get into cultural safety and ethical engagement. We'll describe our community-driven model and what Indigenous knowledge mobilization looks like for us. And generally, you're going to see how a lab that relies so heavily on conversations and relationships and community direction has been able to navigate the additional unique challenges that COVID has brought. So with that being said, I'm going to start by passing things over to my colleague, John, to discuss decolonizing research. John?
Yeah, thank you, Patrick. I'm John, a research assistant with the Morningstar Lodge and from Saskatchewan Treaty 6 territory. I will be speaking on how work at Morningstar Lodge helps in decolonizing research. By the way, we see decolonization as a continuous process of anti-colonial struggle that places Indigenous knowledges at the center of research. So continue to honor Indigenous knowledges. Specifically, Smith 1999 defines decolonization as a process that places Indigenous voices and epistemologies at the center of research. So at Morningstar Lodge, we see research to be more than knowledge creation. So we go beyond the creation of new knowledge to enhance community capacity building, ethical relationship building, and we also live the teachings of the land, which are reciprocity, relationship, responsibility. And so to us, the work we do at Morningstar Lodge, we are not just doing research for the sake of knowledge creation. We believe that doing research for knowledge creation is something that we cannot afford. It's a kind of a luxury we cannot afford. So we go beyond knowledge creation, because you can't see a community problems, a community facing problems, and you say you are creating knowledge for knowledge sake. So what we do, we go into community mentoring, and we mentor communities as to how to apply for grants, how to do research. So you will see that it is an inclusive way of doing research. We have community research assistants. We involve the community from the start of the research project all the way to its end. In terms of even in knowledge mobilization, we involve community. And also we center our research on Indigenous methodologies. COVAC 2010 talks about the fact that you can't talk about decolonizing research without talking about Indigenous knowledges and Indigenous methodologies. So our research is based on Indigenous methodologies, the research approaches we adopt at Morningstar Lodge. So from conceiving the research idea all the way to knowledge mobilization, we use Indigenous methodologies. So these are some of the things we bring in. And what I've learned, I'm also new with Morningstar Lodge, and what I've learned, 2015 talked about the fact that as Indigenous scholars, particularly in academia, Western spaces, we shouldn't just talk about our right to be there, the right that we belong in academia, we have to be in those spaces. But we should also take on responsibilities of opening up the doors wide for newer generations to come in. And subsequent presentations from my colleagues will show how Dr. Bourassa is doing this in opening the gates in these Western spaces, colonized spaces, and bringing in new generations of Indigenous scholars into academia. So what we do at Morningstar Lodge is more than the creation of new knowledge. So, and even within our research team, we live the teachings of the earth. Reciprocity. It's not like we don't do research on our own, each person working on, what we do is a group community. So we live these teachings of the land. So relationship building, we talk about reciprocity and also all those things. So my colleagues who are presenting after me will talk to some of these specific issues as to how we achieve and decolonize research at the Morningstar Lodge. Thank you. Danette.
Thank you very much, John and Patrick. You did excellent. So there is an example right there of our two of our newer research assistants being mentored and giving presentations on behalf of MSL, Morningstar Lodge. So what a great job you both did. Thank you for that. So I'm just going to introduce myself. I'm Danette Starblanket. I've been with Morningstar Lodge, Dr. Carrie Bourassa, since October 2017. Some of the finest work I've ever done in my career. I'm extremely proud of it and proud of her passion and her genuine concern, her love for our people, our community. You saw that here at the beginning. I'm a Cree Soda woman from Starblanket Cree Nation, comes within the Treaty 4 territories, and I live in Regina, Saskatchewan. I'm currently just finishing up finalizing my PhD in public policy from Johnson Choyama Graduate School out of the U of S campus. So I'm just getting ready for my defense and finalize that. I also hold a Master of Arts in Indigenous Studies and a couple of other bachelor degrees as well leading up to that. So I'm happy to be here today. Thank you for letting us present to you and giving you the opportunity to learn. So over the past several years, you'll see on this slide, we've created a number of relationships, partnerships. I'm going to talk about that. Dr. Bourassa talked a little bit about one of our partners, Cowessess First Nation, and the cloud that's hanging over us today as their partners, as their people, as part of that community. So that is something that's impacting our people right across Turtle Island, and it will for the next few days. But we are here with you, and just want to really emphasize those partnerships, those relationships. It's timely for today with what's happened. So when we think about Indigenous methodologies, both John and Patrick talked a little bit about that, kind of set the stage for that with you. Incorporating these methodologies, Indigenous methodologies, is key to the work that we do. So both of them talked a little bit, led the basis of that for me. John talked a little bit about Kovach, Maggie Kovach, Margaret Kovach. So there's some authors who've done a lot of work in this area, and she's one of them. She's one of the renowned ones that we go to. We look at that work and incorporate that work. It's critical, so it's there for you. The literature is out there, along with, as we mentioned, Margaret Kovach and others. So when we look at utilizing Indigenous methodologies, this engages the community. It's absolutely utmost important. It's the very beginning of the process when we look at how to create partnerships and build sustainable relationships. When you incorporate Indigenous methodologies, when you utilize them in your research, you're going to change the way research is undertaken. And Patrick talked about that. He talked a little bit about the before and after, before he came to Morningstar Lodge, and what his experience was like, and what he's going through now, the change that's happening. And you can see the mentorship that goes on. That's a big part of what we do at MSL, Morningstar Lodge, is we mentor research assistants to go out into the communities and beyond after their work with us is done, that they'll carry that knowledge. So it's necessary to make this change. It's absolutely critical because the way research was conducted in the past was simply not effective. We know that. Nobody can pretend it was, because it wasn't. We're leading that change at Morningstar Lodge, changing the way we undertake research, and we're changing researchers in the way they work. And you see that. We will demonstrate this more further by how we're doing this through our relationships and our research partnerships that we've built with community. As we mentioned, the way research was done in the past was not beneficial for Indigenous peoples. We know that. We can't pretend it was. We refer to this old way of doing research as helicopter research, and it's something that has to end. And it is. We're helping to put a stop to it, to end it, and others are as well. So when we think about helicopter research, I want you to think about a helicopter. Ending helicopter research is critical to changing the way research is undertaken with Indigenous communities. So if you can visualize a helicopter, what a helicopter does, a helicopter comes in and virtually out of the blue, unannounced, often uninvited. It's loud, it's noisy, it really doesn't have any understanding of the place it's coming into, that time and space. And it lands where it can. It collects the material, the product, and in this case, data, if you will, for when we're talking about research, and takes off, never to be seen or heard from again. It leaves the people not sure what just happened. So we're going to end that with the work we do at MSL. We are ending that helicopter research. We don't do that kind of research, and we don't promote that kind of research. We're calling it out for what it is. An exact visual I just gave you. And communities don't welcome it. They know helicopter research, they've experienced it. They don't want it. They don't want nothing to do with it. So if we're not sure why we can't conduct research in community, we really have to look at ourselves and say, how are we conducting research? What are we doing? Communities have come to refuse to engage with it over the past few years. They're not having it. They're stopping it. Instead, they've moved towards authentic engagement, and they welcome authentic engagement. So I want to talk about our authentic partnerships now, the ones that we have at Morningstar Lodge. Over the past several years, Morningstar Lodge has developed community partnerships with local Indigenous partners. A critical component of these partnerships is working with them to develop and activate community research advisory committees, CRACs, we call them. It's important to understand that developing these partnerships takes time and effort, but it leads to true engagement, to genuine partners. The CRACs are pillars in these partnerships. Without CRACs, we can't have the partnerships that we do. They are critical. They are the first and foremost. So these community partners, CRACs, and each of our partners has their CRACs. They're comprised of elders, knowledge keepers, directors, whether it be health research, education research, so whatever area of research that is being undertaken. And some of them have very fluid ones, okay? So more than one director sits there. So it's entirely up to the community who their CRAC members are. We don't tell them. We will share with them what other CRACs might look like in order for them to think about how theirs would suit them. And community members, most important. And of course, our elders, knowledge keepers, directors that are within those communities are generally part of the community. They're generally community members. And the CRACs are led by what we call the community research assistant. And this is most important. The community research assistant is appointed by the community. They're appointed by the CRAC. They select and they appoint that person from within the community. So I know with one example I'll give you is one of our tribal council partners, the CRA member there. She would go around and have tea with her CRAC. So she'd put time aside to go and visit, knock on doors and talk about the upcoming meeting, talk about what happened at the last meeting, concerns they had, and sit and chat and have tea. So visit. So very much within that community. The community determines the size of their CRAC. We don't tell them how big or how small it should be, and the makeup of their committee. CRACs are created by the partner because they know their local community. We don't know the community in the ways that they do, and so they're able to appoint those people. When the community research assistant takes the lead, because that community research assistant is appointed by the CRAC in the community, they take their work very seriously. The lab works very closely with CRACs and the CRA. We go to them, they don't come to us. And when I talked about having, to put some work, some effort into partnerships, this is the beginning of that, creating those relationships. The community partners and their CRACs ensure the research meets the community needs and has benefits to the research partners. And again, this is moving away from that helicopter research process. They identify their priorities, their goals, and their objectives, and we work with them to achieve those goals. We work with our partners on the research priorities that they identify. So ideally, we could go away. We don't, of course. But we could go away and they'd be able to continue on with their priorities, their objectives, their goals, what we call a research plan, research agenda. The community owns that, and that's important. We don't own that. Dr. Bourassa doesn't own that. The communities own that. The chiefs and councils and the people from within that community have a huge part there. These are our co-researchers, and we treat them as such. We regard them as such as you would any other co-researcher. So they are co-researchers. They have a vested interest in the research and they own the data. That's most important. This process formally puts an end to helicopter research because our co-researchers are able to design and implement their own research plan and their own research agenda. At the Morningstar Lodge, we're able to do the work we do because we create relationships with our partners, those co-researchers. We sign partnership agreements and research agreements outlining that relationship. We've worked with the CRAs and their CRAC members to co-author publications, absolutely. Sometimes as the lead authors on publications and reports. So we've had CRAs that have led our publications. One example is our Dieter et al. Publication. Jessica Dieter was CRA for one of our partners when we did that pub. So again, having lead authors on those publications. The CRAC members and their CRAs have co-presented with us at conferences and workshops. You'll see pictures of this later on coming up in some later slides. We're extremely proud of that work, and so are they. And it's interesting when we bring them along to the conferences, sometimes there's some hesitation or fear if they haven't done it before. Okay, similar to what John and Patrick might have been feeling here just now, but no, that's gone because they've done it and they know it now. And so next time it'll just be like the back of their hand. So our CRAC members feel the same way, going into the unknown. But when they get there and they get up on the stage and they start presenting, they own it. They take it and they just pull it right in. And when they're done, they're so proud of the work that they did. People are coming to them, whether it's poster presentations or conference presentations, people coming up to them and talking to them, academics, authors, et cetera, funders. So it's very exciting for them to see that growth, right, within their own communities, within their own members, their own membership. We disseminate the knowledge and the work together through newsletters and websites. So again, in the case of one of our partners, the Tribal Council, File Hills Qu'Appelle Tribal Council, I'm going to give you an idea of who our partners are shortly. But in one case here with our Tribal Council, we disseminate our knowledge through our websites, each of us. So we put things out on our Morningstar Lodge website, excuse me, and they put it out on their File Hills Qu'Appelle Tribal Council website. So the CRA for that particular partnership does that work. So they design those that knowledge dissemination, how it's going to look, and send that out. So when we think about that, it really makes those partnerships genuine. Next slide, please. So when we look at what these relationships achieve, it's important to understand that as a mentorship lab, we learn a lot through our partners. They teach us. Our research assistants grow as researchers, and they take that with them throughout their careers. We'll provide you a really good example here coming up with Mackenzie's story. And she's going to give you an example of how that worked in her personal case. Community has taught us an incredible amount, and our RAs and our partners would say that these relationships are beneficial to all, not just the partners, not just MSL and our community partner, but to everybody. And they're cherished by all. Ongoing relationships with community supports community level capacity building and training community members at their direction and diverse needs and various research skills. So whether it be co-presenting at conferences, whether it be co-authoring, so writing, report writing, all of those pieces, that's training that they welcome and they grow from, absolutely. So it's, again, ending that helicopter research where we're coming in, we're pulling out the data and we're going. However, training is also reciprocal for us, as I mentioned, and Morningstar Lodge staff, our research assistants, also receive training from community partners. And some of that is land-based training, land-based learning. And John talked about that and how very important that is and how sacred that those teachings are. Absolutely. But those teachings come through relationships. They don't come on the websites, and they don't come on YouTube channels, and they don't come out in Facebook. It comes with face-to-face land-based. So that training is there for us within those communities. It's in their best interest to make sure we're trained up as well. So land-based learning with elders, protocols and practices for certain ways that individual communities, diverse communities do things. An example is the colors that they might use in cloth offerings. You saw Dr. Bourassa show you at the very beginning were tobacco ties. And so those colors that we use in those tobacco ties are important, and they may differ from community to community. That's the beautiful diversity of Turtle Island. Furthermore, MSL promotes self-determination. So we work with communities to get to this place, and we welcome their knowledge in being self-determining within their own communities to demonstrate that and act that out. Our philosophy is that we serve Indigenous communities and assist them in identifying and creating their research plan and their research agenda. We work for them. That's what it comes back to. And that's the big difference. And that's what changes that relationship. So communities are able to take on their own research plans and research agendas, and they're doing it on their own terms. It's a beautiful thing. Regular meetings with CRECs are established in culturally safe environments that respect the local cultural values of the communities and involve community members sharing their concerns and their goals. Knowledge keepers participating in decision-making, face-to-face interactions, and again, pre-COVID, and we're waiting for the time when we can get back to this, of course. Knowledge dissemination and building everlasting relationships. I want to mention that regardless of what's happened in the last 18 months and how we've been isolated within our own bubbles, we've still through electronic, through digital, Zoom, we've still been connecting and through phone, et cetera, able to connect with our communities and continue doing a lot of the good work we were doing. We had to change a little bit of it, alter it, obviously, to respect those COVID restrictions. But we have not let our relationships go to the wayside, okay? Because we haven't been able to have face-to-face. So when we think about that, that's really important to continue to build and feed those relationships. It's key. So as mentioned earlier, we travel to community. We don't expect elders, knowledge keepers to get in their vehicles and come to the city to see us and sit in a lab. We don't expect that at all. We learn in community and we work in community. And so these are all part of our research projects. It's just what we do. So when I said it takes time and effort, it does take time and effort. And that has to be considered when we're thinking about how we work with Indigenous communities. But it's extremely relevant that we meet them at their place, at their space. Okay? That's critical. And again, with in the case of File Hills Qu'Appelle Tribal Council, for example, we work closely with the hospital in Fort Qu'Appelle as well, of which FHQTC, File Hills Qu'Appelle Tribal Council, our partner, of course, has authority over. So it's when we work in the other organizations and other bodies that they're networked with, that they're part of, it becomes a very big family. Can we switch slides, please? Next slide. So self-determination, I talked a little bit about that. It's the pillar of community engagement. Communities want to be self-determining. They know how to be self-determining. Indigenous communities have always been self-determining. We've been oppressed and subjugated in the past. Policies, legislation, colonization, that has oppressed us. And when we look to how we break through from that, break free of that, some people call it decolonization, some people call it reconciliation. It's all kinds of fancy language that we use for it. But really what we're looking at is letting the community determine for themselves what's best for themselves, because they can and they will. So self-determination is the pillar, it's key. So letting go of the control. Okay? And that's really hard in the academy to do in a lot of ways. We use strengths-based research plans. Dr. Bourassa is very adamant on this. She's big on this, on using strengths-based. We don't look for those deficits. We've been talking deficits for the last 100 years, 50, 100 to 100 years. Let's look at strengths. So strengths-based research plans and research agendas. Avoid working from a deficit-based place. We believe in working from the strengths of the community rather than focusing on deficits. Every community is different, they're diverse, and their research plans and research agendas should reflect what they envision for their people. Community-driven priorities, goals, and objectives. This is defined by the community from within, not defined by us. Again, get away from helicopter research. Community-driven priorities, very important. Incorporates the principles of UNDRIP, this TCPS, Tri-Council Policy Statement, Chapter 9, of which Dr. Carrie Bourassa was part of the creation, implementation of that. Pay attention to it. If you don't know it, get to know it. All of these pieces are available online. You can Google them and pull them up right now. OCAP is ownership, control, access, possession. So our training modules for people, for researchers, highly recommend these forms of training, and they are good first steps. And the care and fair principles, of course. All of these ensure safe and effective research is taking place, and it's up to us as researchers to do that. These training modules are vital to making changes to end that helicopter research I talked about. And of course, we are in alignment. Our work is always in alignment with the TRC's Truth, Reconciliation Commission's calls to action. As you know, the TRC, and if you don't, you should now get knowing this. The TRC set out a number of recommendations related to research with Indigenous peoples. Those must be utilized. Let's not shelve those. Let's not ignore those. Let's pull those out and get to them, get the work done. Communities know about them, and they expect us to be honoring those recommendations. So when we think about that, these are really important pieces and ways in which you can make change as researchers for yourself and the people that you're working with. Next slide. So activating self-determination with community includes supporting communities to formulate their ideas and into plans of action and to apply for corresponding grants. We don't do this for them, they do it, but we support them in doing it. That's key, that's the big difference. Communities want to design and lead their own projects. They know what they want, as I mentioned earlier, and develop their own research plans and subsequently activate those. Supporting communities to hold the grants. This is really important. When we think about self-determination, if you have a third party in there, if you've got a middleman in there, that's not self-determination. So when we think about the interference of the government of Canada in the past and in the lives of Indigenous peoples, that's not self-determination. Partners can only practice self-determination if they are in charge of their own funding. We do not need to be the middleman there. And then building capacity of community members to lead, implement, and disseminate the research in alignment with their unique needs and requests. This is something that communities are eager to do, to inform their own members and their own networks, their own peoples, their own families. They are proud of their research work. They are more than happy to come with us as co-presenters at conferences and workshops and help disseminate that knowledge when we get back home. Okay? So that's huge. Supporting the writing, reporting, and dissemination process. We work with these CRAs and the CRACs to achieve this. They often force changes to the way things were done in the past as well on a lot of this work. So our CRACs do not hesitate to correct us. They will do it on a dime, in a minute, because it's their work. So I'm going to give you an example here. Publication submissions is one really good example. We did a publication a couple years ago on a dementia project that we were working on. And the data we had collected was by interview. And we had we were following status quo of what the publication wanted to see in the submission. And so we had literature review and we had the methodology and all that stuff, right? Our CRACs called it gibblety goop, okay? All that stuff. They didn't enjoy reading it, of course, going through it in the publication. And the data, the interviews was near the end of the pub. Well, our CRACs were very quick and we expected this. We didn't do it without their direction, but we expected it to come, knowing our partner, knowing our co-researcher. Our CRAC immediately said, get rid of the gibblety goop, put the gibblety goop to the back where you've got the data and the interviews, bring the interviews up, and we wanted verbatim, word for word, exactly what our people said. And so we did that. We talked to the publication, we changed that up, and we changed the way they receive submissions because that wasn't the norm for them. So we taught them. So we're teaching, our communities are helping to teach the people out there within the academy, in the academic world. The other one too, of course, is just moving away from status quo, number of presenters at a conference or a poster presentation. So when we have partners, we want them there. We're not going to limit that. So again, changes to the way that we do things in the research community. So ethical engagement is first and foremost in Indigenous partnerships. Training our research assistants in this area is integral to this process. Our partners expect it and they demand it, and because they know they deserve it. Can you change the next slide, please? So activating self-determination with community also includes, in general terms, a person is considered to encompass culturally safe practices if they are able to maintain a trusting and reciprocal, again, reciprocal, trusting and reciprocal, very important. I've lifted my finger. That means I'm really getting stern now. It's the old school teacher in me, right? Trusting and reciprocal working relationship with someone from another culture. And that comes out of Bourassa et al., 2020. Cultural safety is not about culture, but rather it's focused on acknowledging bias and power imbalances. These are, again, key words, bias and power imbalance. So when you're thinking about cultural safety, I want you to think about bias and power imbalances, okay, and bias. That's really important. This is important to understand from a research perspective, that bias and power imbalance can change the outcome drastically. We've seen this. We've seen it with our own two eyes, live streamed for us. We've seen this. In order to effectively discover culturally safe and relevant interventions through research, researchers must ensure that cultural safety is practiced. This is the responsibility of the researcher. It's front and center. Cultural safety in research is a key component of ethical engagement with Indigenous communities, as it ensures that safe working relationships with Indigenous communities are prioritized and relevant. This ends helicopter research. The helicopter has crashed. Next slide. Currently, MSL has a number of Indigenous community partnerships and community organization partners. Our community partners include Cowessess First Nation, Zagime Anishinaabe First Nations, Pheasant Rump Nakota First Nation, and the Star Blanket Cree Nation. And we've created these partnerships. You know, they've, as we say, we've had to put some work into it. But we've created some new ones right through COVID. COVID hasn't stopped us. Okay. We are currently working on a new partnership with another First Nation. So we're in discussion with another new partner on the board, on deck. And we're preparing to establish new partnerships with 2 other First Nations coming in behind once we secure this new partnership. There's diversity in each of these Indigenous nations. I want you to note in the list here of our partners, the difference in the names of each of them. So, and I put emphasis when I said them. Zagime uses nations, for example. Chief Linekus, who's the chief out there, she's taken back her people's power. This is about that self-determination again, as I mentioned earlier, by using the Soto name of her nation. She's incorporated. It used to be called Sakimay, Sakimay. Chief Linekus has taken back her people's power by using that name. And that's their original name. This is reclamation. So she's reclaimed that when we think about, and again, Indigenous people, Indigenous communities reclaiming research. Today we think about Cowessess First Nation and our partner there. That is our partner, our co-researcher, and the news of the children. And Dr. Bourassa talked about that at the beginning in the unmarked grave. So we're really thinking about Chief Delorme today. Our hearts are heavy for him at the residential school grounds there. We have sent our condolences, of course. That was the first thing we did, over to our partner in this tragedy. In this tragedy, we stand with them. So we have those relationships, and they're very dear to our heart. And the people who are part of those relationships, our co-researchers, are part of our family. We also have community organization partners that include the All Nations Hope Network, the Falhouse-Capel Tribal Council, and Les Filles de Madeleine. We will be looking at other community organization partners as well. One of our priorities, though, is really looking to our community partners. Even though we're working with the Tribal Council, the Falhouse-Capel Tribal Council, we're also working with a couple of their member bands. So being partner with the Tribal Council doesn't stop us from partnering with individual First Nations as well. So some of these members, of course, these are members of the Tribal Council. Some of these partners are individual communities. The chiefs at the First Nation level have specific research plans that they want to engage with, and the tribal councils also have specific research plans to be enacted. There is diversity there as well. We also have a number of funding partners that work in collaboration with MSL and our community partners. Those funding partners support our goals with our co-researchers. So they work with our co-researchers. They meet them at the conferences. They see them presenting. We have been able to train these funding partners in how to work with communities as well. And they've asked us for that training because they need to learn. Next slide. So this next slide here, this slide shows our logos from our partners that we're currently working with, including our community partners, our community organization partners, and our funding partners. We're really just getting going. We expect this slide to be 4 or 5 slides in future. Okay? That's how many partners we will have. So again, when we think about that, how we value those partnerships, very important, very dear to us. Those are our co-researchers. So I'm going to leave that there now, hand it over to my colleague Peter to continue on.
Thank you, Danette. Hi, everyone. I'm Pete Hutchinson. I'm Métis Cree. I'm originally from northeastern Alberta, near Lac La Biche area. I'm both my mom and my dad are Métis. They're both their mothers were Métis as well. I'm lucky enough to be residing in the Okanagan, the territory of the Silks. So I'm going to be describing a knowledge mobilization framework that I hope captures how Morningstar Lodge has worked with First Nations, Inuit, and Métis in moving evidence to practice. As noted by Danette, diversity of First Nations, Inuit, Métis is critical and is a constant consideration here as well. So we move that all that respect for diversity and understanding and ways of knowing here within knowledge mobilization as well. KM must fit First Nations, Inuit, and Métis ways of knowing, sharing, knowing and sharing, and it has to be, as noted in the TRC and other regional, national, and international reports. It should be acknowledge Indigenous knowledge must be part of health services. Danette also had mentioned the importance of engaging the strengths-based approach. So too must knowledge mobilization efforts reject the deficit reporting to stop perpetuating the colonial harms. So I've got the next slide, please. Indigenous knowledge mobilization begins with the identification of the research questions and is throughout the research project. Cultural safety is critical to recognize in knowledge mobilization as well. Addressing the power relations in knowledge mobilization is key. Identifying and sharing how knowledge was mobilized historically addresses imbalances that affect how evidence is taken up, and results in identifying knowledge mobilization modalities that are responsive to the communities that are the communities. The methods to create and identify relevant information is identified by community are tied with how information is shared. So there's a I don't like to use the word integrated, but knowledge mobilization is throughout the process of the research that Morningstar Lodge has conducted. Could I have the next slide, please? So the Indigenous Knowledge Mobilization Frameworks attempts to capture common components in projects at MSL. Each theme of the framework has several sub-themes or supportive components. At the core of the Indigenous Knowledge Mobilization Framework are relations. These relationships respect the content of the information and who can know and who can share what information and how that information is to be shared. Overall, the Indigenous Knowledge Mobilization Framework recognizes fluidity and the necessity of staying relevant while maintaining sight on the stories that need to be shared, and those are the stories that were identified in the outset of the research projects. Got the next slide, please. So I'm just making sure I'm in the right place for my notes. Yes. Some KM frameworks focus on end of grant specifically, and the Indigenous Knowledge Mobilization Framework recognizes the importance of what is being produced and shared at the end of the grant as well. It also recognizes that there's knowledge mobilization during the research process, but it is not the sole focus of the evidence that needs to be moved to practice. So it's really critical that fluidity is within Indigenous knowledge mobilization as to address shifting priorities and emerging issues. The context of knowledge mobilization must be fluid, relevant, and always have in mind end of grant knowledge mobilization. The end of grant knowledge mobilization is the reason for the initial inquiry. The Indigenous Knowledge Mobilization Framework also recognized in the Morningstar Lodge's knowledge mobilization efforts the consideration for content of knowledge shared as supportive component of content are inclusive of boundaries. And boundaries are described as the roles of those included in KM and how they access and use the information. Could I have the next slide, please? Also within the theme of content, there needs to be considerations for scope. So scope describes what can be done within the spaces of the knowledge mobilization and recognizes what is being acted upon. So it's keeping a very focused look at what knowledge is being mobilized and how it's being mobilized, and making sure that it's not overstepping boundaries and whatnot, or leaving the end of grant like the target of the research project. Also within contents, it's important to recognize the skill set and training that to where we're moving the knowledge and where the knowledge is moving from. So we have to recognize how the information is used and by whom, and knowing each person's contribution to the project really facilitates that. And it also identifies how they can use the information. Also within the theme of content, there needs to be considerations for scope. Oh, sorry. Go back. Where are we here? So the other part of the Indigenous knowledge mobilization, and probably the key part, is the relationships. So relationships are the core of knowledge mobilization framework and require specific actions to realize Indigenous knowledge mobilization. Supportive actions within relationships, including identifying engagement principles. Engagement principles describe what knowledge mobilization is for each involved, and for the terms of reference, and also describe how a safe place is created. Also within relationships, it's necessary to, as Danette had mentioned, and you've heard before, the term reciprocity. Everyone involved is suitably contributing and investing in the project and receiving benefits of the project. Another action within relationships that's necessary is co-creation. Co-creation is inclusive of everyone involved in creating knowledge mobilization. Everyone is invested in and contributing during the project and are engaging knowledge mobilization efforts, co-creating from the beginning of identifying the need to mobilize knowledge. Within the relationship component, it is also necessary to recognize the power relations. Recognizing power relations acknowledges the history of the relations of knowledge mobilization within Indigenous spaces, how knowledge was produced in the past, and the effects that had. Also within relationships, it is necessary to recognize that knowledge mobilization has to be people specific. So it has to be inclusive and specific to the First Nations, Inuit, and Métis of the area. So it has to be regionally specific. Could I have the next slide, please? So knowledge mobilization at Morningstar Lodge has gained insight from other Indigenous knowledge mobilization discussions as well. These 4 activities identified by ESTE are critical and considered within knowledge mobilization efforts at Morningstar Lodge. So critical actions include clarify what knowledge mobilization means to both Indigenous communities and the researchers, acknowledge past negative research experiences between Indigenous research participants and researchers, and discuss how similar experiences can be mitigated, reach consensus on what doing knowledge mobilization will look like for the project, and discuss and agree on stakeholder roles and responsibility in KM efforts. These really support the creation of a culturally safe knowledge mobilization environment by acknowledging and addressing the power relations that exist within knowledge mobilization. Could I have the next slide, please? Further to ETSI suggestions, Morningstar Lodge recognizes the importance of practicality in mobilizing information. These suggestions by Cooper et al. Are very practical, important considerations. One of the most striking examples of practical applications within knowledge mobilization, Indigenous knowledge mobilization, is to ensure the stories are shared in a language that is used within the community, and to recognize that that might not be English. Could I have the next slide, please? Indigenous knowledge mobilization must recognize and engage local processes of knowledge creation, dissemination, and utilization, and recognize and engage contextual issues for knowledge mobilization, including processes of knowledge creation, dissemination, and utilization, but also engaging cultural safety, health literacy, protection of Indigenous knowledge, the underlying unmet material needs, health and social needs, publication biases, reciprocity, and location. Okay, next slide, please. So Morningstar Lodge respects and engages the fair and care principles of data governance and takes these principles into the publication and presentation of research findings. As Danette had pointed out, there's several, oftentimes we have community research leads present and be primary author on publications. So I'm just making sure that I covered what I wanted to on that slide. Can I have the next slide, please? So here's, no, sorry. It's a little tricky because I'm looking at different slides and are being presented. Anyways, we're all good. So some photos of it. This is a photo of Morningstar Lodge collaborators presenting at conferences. This Orville Spencer from the Carrie the Kettle Nakota Nation presenting at the Responsible Innovation in Digital Health Symposium at University of Montreal in 2020. And then if we move to the next slide, we have another Morningstar Lodge collaborator, Rosella McKay, presenting. And I think her quote here really summarizes how MSL collaborators have been overwhelmed during their efforts in knowledge mobilization. And I think this quote really highlights the need to further support Indigenous knowledge mobilization efforts. And I will now pass it on to Marlon for some excellent examples of knowledge mobilization within Morningstar Lodge. Thank you.
Thank you, Peter. My name is Marlon Laguerre. I'm a research assistant also with Morningstar Lodge. I've been with the Lodge since 2017. And I'm a Métis man residing in Treaty 6 territory. I'm excited to share with you today the Protecting Our Home Fires COVID-19 strategy that we had implemented during the COVID-19 outbreak last March, approximately. We had distributed a number of materials to Indigenous communities that were Indigenous based and culturally safe. These included a COVID-19 fact sheet, which was translated from English into 7 languages and more counting, including traditional languages. We had 19 ways for a healthy home fire, protecting our home fire strategy, 19 things to do at home for adults and children, processing grief during COVID-19 fact sheets, keeping home fire safe, teachable moments for spring foraging, and we had distributed a number of online materials for COVID-19 health and safety, including hand washing, home exercise, muskeg teas, avoiding scams, among other things. We had also engaged in a good food box project, which I'll speak more on later on. Next slide, please. The first of this good food box project was designed to address food insecurity for Indigenous older adults living in urban centers. Food security was an issue before the COVID-19 pandemic had struck, but the pandemic had just exacerbated the issue. We had partnered with Zegame First Nations and engaged in the project through the New Horizons for Seniors program. The research team delivered good food boxes containing wholesome foods and information, including recipes that the individuals could use for the food boxes. So let's say, for example, one of the food boxes contained fish, lentils, and cheese. The recipes would include those ingredients in them. There was also food facts and safety information as well. These good food boxes were delivered bi-weekly over a 14-week period from November of 2020 to February of 2021. Next slide, please. On the left, you can see some of the Good Food Box project materials that were distributed with a emphasis on cultural relevance, both in the information and in the design. And on the right, you can see some of the specifics that we had done with food facts and instructions and recipes. So for example, the one on the right was distributed during the holiday season. So it was foods that are considered typically holiday foods. And next slide, please. Pre and post surveys, as well as key informant interviews, were conducted with our co-researchers to evaluate their food security needs. Once that was complete, the data was then analyzed using a process known as NACPA. It's an Indigenous qualitative data analysis method developed by Morningstar Lodge. What differentiates NACPA from other qualitative data analysis methods is the fact that the community guides the qualitative data analysis process. If you remember my colleague Danette saying that the communities have the capacity, the will, and the drive to guide their research, this is a form in which they do so. Panels with community members are formed once data is taken from key informant interviews and research circles and nearly any other form of data collection. It's then processed into nodes that panels can review together, and a consensus needs to be formed on identifying themes. So the data is categorized, and then once a consensus is reached that certain nodes belong with one another, it's then deemed as a theme, which is separated into minor or major themes. With this process, the team was able to identify the following themes. There were more themes than this, but here are a few examples. Healthy dietary practices, economic and income factors, influences of COVID-19, kinship systems, improved behavioral determinants and comorbidity management, positive lifestyle and dietary changes, reprieve from pandemic isolation, and addressed transportation barriers. And next slide, please. Another portion of the protecting our home fire strategy that I had mentioned was the distribution of culturally relevant materials. So on the left, you can see the processing grief during COVID-19 and a what can we do sheet, and it provides materials on processing grief, and everything you're seeing here was translated into a number of traditional languages as well. And next slide. Again, this was a part of the protecting our home fire strategy. This is just some safety and health information here. And some ideas of what to do during the pandemic that was, as you can see, translated into a traditional language. And next slide, please. Here is a COVID-19 fact sheet for Indigenous communities. When the COVID-19 pandemic had first struck, misinformation was a major concern and to some degree still continues to be. In order to combat this, the Morningstar Lodge team had created and distributed COVID-19 fact sheets for Indigenous communities based off of peer-reviewed scientific data and delivered in a culturally relevant manner. So as you can see, there's facts on the COVID-19 pandemic, as well as additional safety tips for prevention and control. And next slide. In a more traditional side of things, the Keeping the Home Fire Safe Teachable Moment Spring Foraging, brought to us by our guiding elder, Betty McKenna, was distributed to Indigenous communities as well. She had guided us through a number of traditional medicines as well as their uses, as well as provided recipes for traditional teas with health and healing properties as well. And with that, I will pass things along to my colleague, Megan. Thank you so much.
Thanks, Marlon. So my name is Megan. I am a research assistant with Morningstar Lodge. I started back in September 2020. I am a settler, and I'm living in and working from Ottawa, Ontario, which is the traditional and unceded territory of the Algonquin Anishinaabe peoples. And I will be talking about Morningstar Lodge's vaccine strategy. So kind of how it has developed from our Protecting Our Home Fire strategy. And this involves the vaccine fact sheet, an empowerment table, 2 social media campaigns, and then also a partnership with Solutions for Kids in Pain. So on the next slide, perfect, you can see this is the vaccine fact sheet. So as vaccines were rolling out in communities in January, Morningstar worked with Chief DeLorme from Cowessess First Nation, Chief Star from Star Blanket Cree Nation, and Karen Larocque from Les Filles de Madeleine, as well as All Nations Hope Network, as they wanted to support vaccine uptake and address any hesitation that was present in community. So through our partnership, we highlighted several topics and then, highlighted several topics of main concerns of community members, and we narrowed it down to the 10 bubbles you can see on the left-hand side. And the topics vary, but they range from mRNA and its effects on DNA, different myths such as MMS as a preventative cure or measure for COVID-19, the safety and efficacy of vaccines, the timeline of COVID-19 development and why it was not rushed, other suggested resources for COVID-19 and related vaccine information, and the available vaccines in Canada. So once we had all these main points highlighted by community partners, Morningstar Lodge and research staff at Morningstar Lodge reviewed the literature and created a fact sheet that spoke to the unique needs and questions of community members. So it was then reviewed and approved by community before its implementation. It is available online on our website, and it has been printed and distributed within community at several locations, such as vaccine clinics. So on the next slide, you can just see the backside of the fact sheet. So here is where we kind of just expanded upon those initial bubbles and points that were main concerns for community members. On the next slide, this is the vaccine empowerment table. So as more vaccines were approved in Canada in the spring, Morningstar Lodge was asked to create a vaccine table that summarized the available vaccines, such as their similarities and their differences. So there are, of course, resources pertaining to the approved vaccines available on the Government of Canada's website, but there is a lot of information to kind of wade through, which can be overwhelming and also time consuming. In addition, each vaccine has its own web page, so individuals would have to read up on several sources to get a complete picture of the similarities and differences between each vaccine. So to address this, Morningstar Lodge's research team created this table to summarize the information community was looking for in one place. And like the fact sheet, this is available online, and it can also be printed and distributed. So this is just the first half of the table where we have the 2 mRNA vaccines, Pfizer and Moderna. And then we address the different topics. So the type of vaccine, its mechanism, how many doses are required, safety and efficacy, the ages it's authorized for, and potential side effects. And then on the next slide, you can see we have the 2 viral vector-based vaccines, AstraZeneca and Janssen, with the same information. On the back side of the resource, we have included FAQs that have continued to be discussed in community, so that this could be as much of an all-in-one resource as possible. So currently, both this empowerment table and this version of the fact sheet are in English. However, in order to increase their reach, Morningstar Lodge has applied and received funding from the Saskatchewan Health Research Foundation for translation of both the vaccine fact sheet and the empowerment table into requested Indigenous languages. So moving more into the social media realm, we have our 2 COVID-19 vaccine campaigns. So Morningstar Lodge again partnered with Chief Delorme, Chief Star, Karen LaRocque, and All Nations Hope Network to create the Chiefs Vaccine Challenge, which uses social media such as Facebook, Twitter, Instagram, TikTok, really anything with the hashtag to share vaccine experiences with photos or videos. So specifically, the campaign was designed to promote conversations around why individuals were excited or looking forward to getting their vaccine, happy that they had already received their vaccine, or why it was important for community in general. So by means of social media, individuals can recruit their friends, family, and community to participate. And then the second campaign that we're working on, which will be hopefully launching in the coming weeks, is called the Aunties Challenge. And it's in partnership with Les Filles de Madeleine and is partially funded by the Public Health Agency of Canada. It's similar to the Chief Challenge in the sense that it seeks to promote the uptake of COVID-19 vaccination. However, the name of the campaign comes from the women in community who hold respected positions within Métis culture and act as sources of guidance, support, and knowledge. So the campaign seeks to promote video footage of Métis women receiving their COVID-19 vaccines to encourage others to do the same. It will then use the hashtag Aunties Challenge to challenge others to share their own experiences with the vaccine and explain what they're looking forward to once everyone has been vaccinated. Awesome. Okay, so the next slide, this is some of our work with Solutions for Kids in Pain, which is SKIP. So we partnered with SKIP to create pamphlets for children and adults to address and mitigate needle fear, pain, and hesitancy, and ultimately promote COVID-19 vaccination. So these pamphlets were actually adapted from an existing pamphlet from the Alberta Health Services. And they've been provided to community members before their vaccine appointment so they can fill it out ahead of time or bring it to the appointment to keep busy. These pamphlets also work to build relationships between community members and healthcare providers. So this one here is the children's pamphlet that we created, and you can see there's some interactive pieces. You know, you can draw on the front cover and answer questions about your favorite toy and that sort of thing. So it's to keep kids comfortable throughout their vaccine appointment. On the next slide, we have the adult pamphlet that Morningstar Lodge created, and it is similar to the children's pamphlet, but there are content warnings on this one, as there are topics relating to trauma, as this is the reality for a lot of Indigenous peoples in healthcare, and a lot of traumatic experiences influence healthcare experiences. So this provides the opportunity for individuals to disclose this information to their healthcare providers if they feel comfortable to do so. This is also very important for healthcare providers to kind of recognize the colonial history of healthcare and science, and keep this in mind when they're working at the clinics. So as mentioned earlier, everything done at Morningstar Lodge is directed by community. So these pamphlets were shared with partnering CRACs for their review, feedback, and approval, and they're very happy with them. So the next slide we've included just to kind of show you how Morningstar Lodge works with community. So like I mentioned, Morningstar Lodge is under direction of community. And as the pamphlets were being developed, we shared them with the Star Blanket Cree Nation CRAC. And they're very happy with them. And then they even suggested potentially creating a storybook for families to share with their children to explain vaccination and mitigate any fears and concerns. So in this slide, you can see the very beginning of the story coming to life, where we have our main character, Louis, who will be accompanied by his cookum to his vaccine appointment, and it will frame COVID-19 in an interesting way for young children and families. So this is just an example of how Morningstar Lodge is always under direction of community, and we are always guided by our CRACs. We listen to the ideas, and we are now working with solutions for kids in pain to make this happen. Awesome. So I'm going to pass this off to my colleague, Mackenzie. Thank you.
Thanks, Megan. So my name is Mackenzie Jardine. I'm a Métis woman from Regina, Saskatchewan, or Treaty 4 territory. I'm going to talk about my story as an example of how Dr. Bourassa supports Indigenous peoples and particularly young professionals. So I started working with Dr. Bourassa 4 years ago as a summer student before getting hired as a research assistant. The team at Morningstar Lodge has grown significantly in both number and collective capacity during this time, and the cohesiveness, teamwork, and mentorship have contributed to all the amazing work that is done by the team. Dr. Bourassa has supported not only myself, but also many other undergraduate, graduate, PhD, and postdoc students. When I started as a summer student, I was transferring between undergrad programs and had a distant goal of going to medical school. Working in the lab, I gained not only technical research skills, such as grant applications, data gathering and analyzing, and report writing, but also an understanding of the importance of community engagement and working with communities to contribute to the health of Indigenous peoples. Similarly, Dr. Bourassa also understands the importance of support from elders in ceremonies and ensures that we have access to these supports as well. Dr. Bourassa's mentorship supported my decision to apply to medical school, and now that I am in medical school, knowing that I have the support from Dr. Bourassa and the team at MSL brings me great comfort, because medical school is very demanding, as I'm sure most people would imagine, and it is critical to have people who cheer you on. Although medical students, or most students, do not also work during school due to the high demands and expectations, Dr. Bourassa has always been very understanding and puts education first, which has allowed me to continue working a few hours while I'm in school. I think this is very important because Dr. Bourassa is supporting a new generation of professionals who contribute to the health of Indigenous peoples and advocate for equity through various professions. And one of our team members used the phrase "Carrie ran so others could walk," and I think this is a very good description of how hard Carrie has worked so people like me can have a network of support to rely on. So thank you for listening to my story, and with that, I will pass it back to Danette.
Hello. Yeah, just had to make me tear up there, didn't you, Mackenzie? We were good in the run through. I was solid like a rock, but I don't know what today. Teary eyes. Thank you for that, Mackenzie. And I just want to, reiterate what Mackenzie shared there. I mentioned to you that I'm finishing up my PhD, just going into the defense stage of it. And Dr. Bourassa is the same with me on that, and all of our RAs when we need her, she comes to bat for us. So during my time when I had to do some edits, she let me take that time and continue helping in the lab to the degree that I could, but let me step back so to be able to do that. So when Mackenzie speaks, it's very sincere and very true and very genuine. So we've all had that experience with Carrie, and we can't thank her enough for that. So with that ends our presentation. I'm all bleary-eyed now. Ends our presentation, and I do want to open it up for questions or ask you if you have any clarification that you require at this point. Now's the time. Any questions, comments? And they say if we don't have very many questions, then you must have did a pretty good job, hey? Okay, so just seeing in the chat now, thank you for those comments to those who are watching and listening to us. And if you don't have any questions or comments, I will pass it back over to Carrie and she can close for us. So we'll go to the next slide. Just before I pass back over to Carrie, I just want to mention we do have on the first few slides pictures of all our RAs and our lab staff, our elders and our leaders. So we've got a number of our RAs that aren't with us today. They're off with other things or away. We are supporting one in her academics right now, just like Mackenzie mentioned. So she's stepped away just a little bit. So I just want to mention those RAs that didn't present here today. Our leader of the pack is Carrie McElduff. She's running our slides for us, but you didn't hear her speak. So her picture is up at the front. She's our lab manager. So she's on the slides. I think it's slide 2 and 3 or 3 and 4. Some of the early slides where we've got our pictures. Also, Tammy Popova didn't present today. She's one of our RAs as well, and one of our new RAs coming in. And Heather Owatch is our newest RA, although Heather was with us a time before, and that's always a good thing. When somebody was with you, they go away, they come back. Goes to show how good you are, right? So Heather's back with us. So that's Heather Owatch. Miranda Keewatin is also didn't present today, but you'll see her picture in those slides, those early first few slides. Shayla Digerly as well, and Michaela Hagel. So those are some of our RAs that didn't present today. Also in the pictures of our lab and our family is up at the front is Elder Ethel Starblanket Dubois, Elder Betty McKenna, our guiding elders, and Elder Mary Wilson. So just wanted to mention that. I'll hand it back over to Carrie now.
Thank you, Jeanette. There's a question here about urban and off-reserve Indigenous communities versus rural on reserve. We don't really have distinctions between those because we work with all of those communities. And so I think the application for each of those communities, you know, because we take direction from the communities, so you know, we can adapt any of the methods to the communities that we serve, because it's not any of our ideas. It comes from the communities. So we do work with rural communities and remote communities. We work with urban communities. So you know, the methods that we use, they're adaptable to the communities that we serve, because, you know, whatever they tell us to do, we do. So I'm not sure if that's helpful or not, but we certainly do have you know, different publications that might be helpful, but you know, basically it's adaptable to the communities, regardless of where they're residing. I hope that's helpful. I'm not sure if anybody else wants to add to that, but.
No, I think that's a good way to frame it there, Carrie, is that, you know, we do work with urban and rural. And of course, you know, funding envelopes are different there. So depending on grants as well as to what we can do with them, you know, as far as assisting them in grant applications. So I think you nailed it on that, Carrie.
There is one hand up. Sorry, Carrie, there is one hand up by someone, but I can't read their name.
Yeah, I'm not sure who it is. So if you want to, I'm not sure who has the hand up, but if you want to ask your question. Yeah. There's also a question about co-authorship.
Good afternoon. My name is Mariam Walet Aboubakrin. Thank you very much for organizing this workshop. It is very informative for me. Like, I'm an Indigenous person, but not from Canada. But I'm joining the call from the ancestral territory of the Algonquin and Anishinaabe in Ottawa. I'm myself a Tuareg woman from the Sahel and Sahara region. The presentation was very inspireful, but also very informative to me. I have a question about, because there were a mention of the participation of community members in defining the research subject or theme. I'm really curious about how the nations or community are involved in that. For example, as the impact of the research we are not doing, as Danette said, a helicopter research. So how the team or the area of interest or of the research is defined and determined by the indigenous peoples themselves. So this is my first question, and the second one I will be very brief for that. Is how the data sharing is respecting the sacredness or protocols of use of indigenous knowledge. So there is that challenge of like making our knowledge public, having some part of the knowledge like in websites or blogs on things like that, and it can land on hands of people who are not really prepared and aware on how to really manage and use that kind of knowledge. So these are my questions, and thank you very much again. I learned a lot.
So the communities that we work with, we don't go into communities and ask them to work with us. Communities generally engage with us and tell us, you know, what they need, and what kind of research that they're interested in, and then they basically sort of give us their marching orders. You know, they let us know what they want us to do, and to what degree that they want us to be involved in. You know, every community is different, even communities that might be very close together. So in southern Saskatchewan, we have, you know, I think 4 communities that we're engaged with right now, and Jeanette mentioned that there's at least one more, and likely others that want to work with us, and those are First Nations communities. And then we have Métis communities, and of course they're all very different, and so we're just there, you know, when they engage with us and they ask us to work with them, we're there to serve them. So, you know, whatever it is that they want us to do, we develop a research agreement, we develop a data shared agreement, and they can change that at any time that they want. They can also say to us, okay, you know, we're done with you, and we don't want to work with you anymore at any time. So it's we don't come in with an agenda. We don't, you know, we rarely ever go to a community and say, hey, we want to work with you on this project and we have something in hand. That's happened, I think, one time in our whole, you know, time that we've ever had Morningstar Lodge, and that was because it was the CCNA project, the Canadian Consortium on Neurodegeneration, because they did not have an Indigenous person to assist with that project. And so we actually went through a very long process of engagement before there was any decision that was made, and the community engaged with Chief and Council. That was the only time. Other than that, communities, for the most part, engage with us and say, this is what we would like you to do, this is what we want, and that's how it goes. On the second part of it, you were asking about, oh, I lost the train of thought. She asked about, what did she ask about the second one? Oh, was it publications?
Yeah, public sacred knowledge, basically. How do you make sacred knowledge public, right? That Indigenous knowledge.
Yeah, so anything to do with sacred knowledge, it comes from the elders. And so the elders that we work with, first of all, we have to go through ceremony with the elders. The elders give us, basically say to us what can and what cannot be shared. And for the communities that we work with, again, that's another layer that we would have to work with the communities who have their own elders. So it all comes down to elders and what the elders say can be shared, what cannot be shared, what is seen as sacred and what is not seen as sacred, and particularly with medicines, for example. So if we're picking medicines and we're learning with the elders, we have to be very careful about what we're allowed to share, because some of the medicines could be sacred and some of them, you know, are not sacred. So if you looked at some of the photos that we were able to share, none of those are sacred. None of those are sacred because the elders told us that we can share those. So that all comes down to what the elders tell us. Jeanette, did you want to add anything?
Oh, I think we hit it right totally exactly. You know, we totally, as mentioned with our relationships and partnerships, we totally go with what the community is allowing, right? And what they let be put out there. So in the knowledge dissemination, very much back to community direction. Community, you know, determines that and defines that and shows us how that looks.
Yeah.
And of course, some of it is, and they'll be the first to tell you, those knowledge keepers, they're not going to violate their own protocols and processes. They'll be the first to tell you, we can't put this in print, right? We know this, but we can't put this. Those who need to know this will come to learn it through ceremony, like Carrie said, right? But yeah, there is definitely things that, you know, we can't just put out on websites and newsletters, definitely. So we have to respect that. That's all part of that cultural safety.
Yeah. Any other questions? Or I think that Jeanette and Carrie were answering some in the chat. So
yeah, we did answer some in the chat there. Somebody's asking how to be a CRA. CRAs really belong to that local community. They come from that. So the community really defines and determines who the CRAs are that represent or lead their group. Their CRAC. Now, if you were looking to become an RA at Morningstar Lodge, that's another story that you can talk with us, you know, directly. You can contact the lab or contact Carrie, myself. And we do have contact information there on our last slide. And we're always willing to train up people and have people part of our team. So provided there's funding there, right? I shouldn't speak too quickly.
Yeah, we're growing, that's for sure. We're growing and always looking for new funding opportunities. So if you're interested, yeah, certainly get a hold of us, as we are definitely growing, and it's a good opportunity in the next little while to certainly expand.
I think Connor had a question about miscommunication around COVID and traditional foods as well, and Carrie has answered that, but I just want to add to that a little bit. I don't know if Marlon has anything to add there, but we did see, you know, in communities where communities were looking to their own ways, traditional healing practices, and that there was some diversity there. But again, understanding that was for them, that was what their knowledge keepers and their elders and their visionaries told them to do. So whatever it was, whether it was plant medicine or practice of some sort, in order to, you know, reaching back into those traditional understandings of what might help. Of course, nothing that was a cure, but things that might help to keep us healthy during this time.
Yeah, and there's a question here about if you have any ideas on how to approach and develop relationships with communities. You know, that's always a tricky question. You know, it does take a very long time to develop relationships if it's sort of, you know, cold calling, but I always say now, you know, we developed the NEARS, the Network Environments for Indigenous Health Research, and the NEARS originally, you know, those NEARS were originally for sort of academics, and wearing my CIHR hat, I can tell you that we wanted to flip that, because what we were hoping is that, and we did, in fact, change the NIRS at the direction of community, and communities wanted the NIRS to come back, because the NIRS were shut down in 2012. And the NIRS were very successful, at least in terms of bringing up, Indigenous researchers, and I was one of them. Believe it or not, I'm really dating myself now, but we were able to actually get through the NIRS, the original NIRS, like 300 Indigenous and non-Indigenous researchers out of the academy, which was a huge success. But when that sort of went away, we had this huge gap. And so communities, when I came on as scientific director in 2017, the community said, hey, we actually have a lot of community researchers, and we want to be able to hold our own funds and really be the ones leading the Indigenous research agenda in Canada, and that's what we needed to do. So the NIRS, we invested $100.8 million over 16 years. There's a NIR in every region, so there's 9 NIRs. And so really what you might want to do now is, depending what province you're in, you could now go to the NIRS and say, hey, I'm really interested in learning how to engage with communities, because the NIRS are really meant to connect communities with academia, and to help to train up Indigenous scholars and Indigenous community members. And that's a one way that you might be able to sort of have a really viable way to engage with communities. That's what the NIRS are supposed to assist with. And they're just getting started. They've just gotten into their first year. And so now getting their feet underneath them, that's one way that you can sort of have an entry into Indigenous communities. Having said that, of course, you can engage with communities. It's difficult right now, obviously, with what's happening with residential schools. But there's other organizations like Canadian Aboriginal AIDS Network, or I think they've changed their name to Indigenous AIDS Network. That might be a good urban community. Also, some of the friendship centers, those are really good organizations that are often looking for young researchers to come and learn. And it's a good entry point for you to become engaged before you sort of go into some of the rural communities. But maybe others have some idea. Danette and Carrie and Peter, maybe you have other thoughts, but those are some of my initial thoughts.
I think it's really important to start to build those relationships, right? And I know lots of people will come running to Carrie and say, can you help create this relation, this part? And it's, it's up, as we mentioned earlier, it does take some work. It takes some time and effort. Don't be afraid of that. So don't be afraid to reach out and say, look, it may start with a simple meeting of whether it be a coffee or a snack or whatever it may be, to meet with the prominent people that are coming out of that community. So how we generally do it is we'll connect with the leaders, the community leaders, or the elders within that community, and we'll network in that way, if possible. So you really need to reach out and say, we would really like to partner. It's not about doing the work for them. It's about working with them. And you're working for them. You're almost like, think about yourself as an employee, okay? In that sense. So it's building that relationship, which takes oftentimes 2 or 3 or 4 visits or meetings before you even begin really talking about what some of the potential things you could do together. So getting a real feel for the community and the diversity coming out of that community. I'll give you an example. When we talk, we're really thinking about Cowessess today, and Chief Cadmus Delorme. Chief Cadmus, we know he's a young, educated, far-reaching chief. And so he has high expectations, and he is going to make sure that his community is protected and that they're safe. So we know that about him. So we knew that going in, for example. So it's good to know about the community that you're looking to create a relationship or build a partnership with. And I just kind of thought about the urban and rural piece. When you're looking at the differences there are some differences that should be acknowledged when you're looking at building a relationship with an Indigenous urban organization in the city, in an urban center. You have to be prepared to be creating relationships with diverse groups. So you're not just looking at one people, if you will. So when we look at our First Nations that we're partnered with, for example, Cowessess, we're talking about the people at Cowessess First Nation. If we look at All Nations Hope Network, we're looking at working with people from all over the place, not just in Saskatchewan, but outside this province. So, but all urban peoples. So it is a very different relationship, and we have to be even more diverse and understand the diversity of that particular partnership. So urban partnerships can be challenging in the sense that you're dealing with more groups of people, more diverse groups of people in one, okay? So that, I just wanted to add to that on the urban rural piece.
I think I just want to jump in here as well, Danette, and just say, for those of us that are non-Indigenous, I would really, really encourage that there is a significant need for understanding that our Indigenous peoples that are doing this important work are stretched. And Danette kind of alluded to it, where people will contact our fearless leader and say, how do we get engaged with this community? And it's just not in necessarily that space. Dr. Bourassa can't always connect people. As you can imagine, she's extremely busy, but so are all of our Indigenous leaders. I would really educate you, as Danette alluded to educate yourself before you walk into a conversation with a community or with a leader. And just be aware that it does take time, that this is time that you need to spend on building those relationships before any funding becomes available. Because if there's only relationships built when the funding is there, the relationships aren't going to be strong. The relationships aren't going to last. And there's going to be less trust and respect there for you, because it really often, when we build relationships, how we're taught in non-Indigenous, in a colonial space, is to build those relationships when we have funding. That is not ever going to work appropriately. The other thing I really want to stress is, as a non-Indigenous person, as a ally, as declared by my colleagues and my friends and family, that our Indigenous peoples are overburdened. And so if you can do the work and you can support, not that you're being a white savior, but that you're supporting up and putting forward Indigenous voices and Indigenous needs, that you can do some of the work led by Indigenous peoples.
I'm just going to add one more thing to this conversation about relationships and relationship development, and that's that it's a long-term engagement. The relationships just usually don't exist over the research project and the funding period, but extend well beyond that. So you have to be prepared for that in the relationship development. That's all I wanted to add. Thank you.
Yeah, it was the same thing I wanted to say. Peter just said it off my head. Yeah, so once we have to be prepared. It's a long-term relationship, and it lasts forever. So when we go into Indigenous communities, we are not just going to develop the relationship immediately the research ends, then we are out to. Now, it is a relationship forever. So we have to be prepared for that too. So it's not just to extend, it extends beyond the research duration. So that is something we have to be aware to. Yeah, so when we go into Indigenous communities, their problems become our problems. We are family. I did my research back home in Ghana, Africa. And before I went into the community, or before we engaged in the research, we kind of communicated. But now how I relate to the community has changed. Once there's a problem, I am among the first 5 to get a call within the community. So we have to know that it's forever. We are family, and we have entered into this mutual relationship of respect, reciprocity, and responsibility. The knowledge we also carry out, we have the responsibility to represent that knowledge in a culturally safe way. So these are things we have to know. Yeah, thank you very much.
Indeed. Well, this was, I think, just a wonderful, wonderful afternoon, and I want to thank all of the presenters, and I want to thank the CanCOVID opportunity. Thanks so much, Susan, for giving us this opportunity. It looks like we may have another opportunity, perhaps to present in the fall, maybe with a cultural safety lens. That would be great. So I don't think there's any other, it doesn't look like there's any other thoughts. So I just want to, again, thank all of you. This has been really, really wonderful presentations. And yeah, if, feel free to reach out to us if you have any other questions, or if you, want to engage with us in any other way, or if we can provide anything else that might be helpful. But if not, then again, just want to thank all of you from the bottom of my heart, and wish you all a good afternoon, and hopefully you'll take care. Miigwech.
Thank you so much, Carrie, and to your team, Miigwech. Thank you. Bye-bye, everyone. Have a lovely afternoon.
Bye. Thank you. Miigwech.
Thank you all.
We would like to thank our speakers and members of our network for their continued support and participation in Canada's pandemic response. If you are interested in learning more about CanCOVID or joining our Pan-Canadian COVID-19 Research Network, please visit our website at www.cancovid.ca.